Gauteng MEC of Finance, Jacob Mamabolo, tabled the Provincial Budget for 2023-2024 at the Gauteng Legislature. Allocating budget to the departments that need it the most, 5 billion rand was allocated to the Gauteng Health Department. We spoke to Nomantu Nkomo-Ralehoko, MEC of Health and Wellness, about her view on the budget.
You're talking about the Gauteng budget, which MEC Mamabolo allocated an additional 5 billion rand to your department. Now, only 784 million has been allocated to a backlog. What backlog is he referring to?
We have a serious backlog on surgical backlogs, your cataracts, your hip replacement, quite a number of operations that we're supposed to do. So, in fact, we have been sitting at 32,000 in terms of that backlog because most of our hospitals couldn't operate in 2020 and 2021. We only started last year to go back again and do some operations in the theatres. But another thing, we have not a number of theatres in our hospitals because they are busy. But now we have made agreements with some of the private sector hospitals. They are going to borrow us their hospitals. So we're going to borrow from Peter to Paul. Some are going to give us voluntarily because pro bono, including some of the professionals that are going to work with us at pro bono, trying to assist us to reduce the number. In the last 3 weeks when I was getting a report, we're sitting at 28,000 from 32,000. But we want to move, I'm sure now, because it's 2 weeks after that. I think when I get the report next week, we'll definitely be down again. But we have given ourselves a target. I said, let's work on it as if it's a project. I've joined a project team that comprises of some of the professors and the doctors in the department that must work on specific areas. If it's your knee replacement or hip replacement, where can we take you? What are the specific areas? So I think with this amount of money that he's giving us, it's going to help us to reduce that surgical backlog that we're having in the hospitals.
Now, the remainder of the balance, what are you planning to do with that, or where are you planning to allocate that funding to?
Because that 5 billion is, you remember we have the medical legal claims in the department. Definitely we are going to take some of the money and pay some of the accruals that we have in the department. In fact, when I was asking for money at the treasury, I wanted money for accruals. And when I was counting them, because you know I've done finances, I've been there. If we can just get to 2 billion, it will reduce our accruals because we were at 5 billion and then now we're at 3 billion. And then I was saying when I was asking, at least 2 billion will do something. But now if they give me 5 billion, we will see how do we play around with it, because even in those accruals, we still make arrangements with some of the companies that we are owing. We have a mediation team that I've put up. Instead of going straight for litigation, we start with mediating and say to you, we know that for the past 10 years, we owe you 20 million, but now can we sit down and see how can we settle that 20 million, reducing the amount in terms of how much can we pay you, because we don't have money as the department, and what you think. And most of the service providers, once we go and do those arrangements to them, they have agreed. So we've made agreements with them. Some of them I will definitely use on that, because I want to put a tombstone, that's the word I'm using, on accruals in the department, because I want that department to go back to clean audit. Come March, we will make sure that we close the accruals, we put them aside, because we have done some measures in terms of how we can use the money. In fact, we are stable financial now as the Department of Health. Although we still have those elements of accruals, we're dealing with irregular expenditure, and I think even on that side, we're going very well. Even last week, I was in the finance department checking them, how many times can we take to pay a service providers. If we have money, we can take less than 15 days or 15 days or more to pay service providers, not even 30 days. So I said to them, starting from 1st of April, with what we'll be having, we will be reversing with what we have and using some of the money that you're talking about to pay those backlog. But moving forward, everything must be clean, start on a clean slate. We're tightening up controls in the hospitals. Remember, at some stage, Premier Makura said, let's decentralize some of the services that we are doing at the central office to the hospitals. Criminals ran and followed that decentralization. So what we are doing now, if you can see what happens at TNBSA, it's because of the decentralization that we did. Give most of the powers to the CEOs. Then the CEOs work with the service providers that have been messing up the department at the province. Now I'm bringing back those powers. CFOs and CEOs every month accounts to me in the executive management meetings, because if you want accountability in the departments, you must be hands-on as an MEC. And that's what exactly I'm doing. I'm not mismanaging, because sometimes if you don't understand the PFMA and how to run the department and the administration, advantage for me is that I'm the administrator. I'm finalizing my master's in administration, so no one can tell me how to run a department, because that's my specialty. Being a politician, it's something that it comes by the way. I'm more on the administration, so I am like them. I know when there are loopholes and where must I tighten up those loopholes.
I think lastly, touching on this, there is this a lack a lack of staff, medical staff in some of the hospitals, and now bounce on what we've heard this morning on the strikes in our hospitals. I know the minister came up and he's condemning it, saying that the unions are violating the staff who doesn't want to go on strike. Do you see allocating some of the portion to safety around hospitals, or allocating some of the portion to get more staff at these hospitals?
Yes, we're going to get more staff in the hospitals. We do have some money. It's about 600 million that we've been given that we must do for the capacity of our hospitals, especially on staff. Specialized staff in particular, that's what we are going to prioritize on, because there are specialties that we need, and we are going to utilize that money for that, strengthen that area of capacity, which at least it's going to help us to improve even on the services that we are doing. But again, on the infrastructure, the money that has been given to the infrastructure department, we want to facelift our departments. We need to improve the facelifting of our departments. But again, there is a system that I'm coming up with in the department, because I remember I was an MEC for ICT, which is e-government, on queue management system. We are going to have queue management systems that we are going to do. I always use the word, let's operate like a bank. So we'll be operating like a bank in terms of the services that we are doing to the citizens.